Hi guys, how have you been? I hope you all are well. So, today we're going to continue learning about depression, how to cope with it. This is part two of our series, so I hope you follow along. So, today we are going to learn about different signs and symptoms of depression. Um, so, this is what you need to look out for in yourself or in your loved one. If you notice some of these signs, yeah, you might need to seek professional help or try to help your loved one seek professional help. Okay. Sign number one. So, sign number one is persistent sadness. Feeling sad, empty, lost, lonely all day, almost every single day. You or your loved one is not getting out of that state. They dread even getting out of bed. They don't want to eat. They just feel sad for no reason, or maybe for some small reason, but it just isn't going away, and it just keeps, getting worse and worse. That is a sign of depression. Sign number two, loss of interest. When you or your loved one start to lose interest in things that used to interest you, I talked about it this yesterday, like when you maybe, let's say, love to cook or love to play football or anything, the things you have always loved to do, all of a sudden you lose interest. You don't want to do it. You just don't want to do it. That can also be a sign of depression. I'm not saying that everyone that loses interest in what they have always loved to do is depressed, but it is one of the signs to look out for in a depressed person. Sign number three is changes in appetite and dramatic changes in weight. It can be weight gain, which will be due to an increased appetite. Some people tend to hyper eat when they are depressed. Binge eating, you know, it helps them cope with the feelings of sadness, and then others just don't want to eat at all. They lose appetite, which of course results into weight loss. So that's also something to watch out for, and that can be lethal. So that is something to really so much watch out for. Mostly the weight loss part, where people don't, because when you don't eat, of course you're going to develop different kinds of illnesses, and that can be, like I said, lethal. So watch out for that too. So sign number four, I don't remember. So the next sign to look out for is sleep problems. Some people get insomnia or hypersomnia, where you either do not sleep, lack of sleep, just for no reason. You're not up working, you're not doing anything, but you just can't seem to sleep. Or your loved one, they just can't seem to sleep. They're always awake, or they have hypersomnia, where they oversleep. The where they oversleep. Someone that used to wake up early in the morning and is hyper tends to oversleep up to like midday or even later in the day. That is also one of the signs to really watch out for in depressed patients. So if you or your loved one is experiencing either hypersomnia or insomnia just drastically, you need to watch out for that, and seek professional help as early as possible. Let's go to the next sign. The next sign is fatigue and lack of energy. Even when you've not done anything, you've not been overworked, but you just have this feeling of tiredness and lack of energy and willpower, and you just like you don't want to even lifting a mare with this jar of cookies becomes dreadful. Like you feel like that's a big old task just to lift this, and you find little things, little tasks to you kind of feel like a lot of effort. That can also be one of the signs of depression to look out for in yourself or your loved one. Yeah, and this lack of energy and this fatigue can be, I'm not saying that when you just suddenly feel fatigued and lack of energy, you should just know you're depressed. No, I'm saying when it is persistent. Most of these times I'm talking about if they are persistent and they're not going away for some time, that's when you need to, seek professional help. But sometimes, it can just happen, once or twice, a week, just feel, you don't want to do it, you don't just want to wake up. It's not like that serious. But when it's persistent and it's ongoing every single day, you're just feeling the same every day, that's when you need to, watch out. Agitation and irritability is the next sign to watch out for. If you are, or if you or your loved one is easily agitated, and this I'm talking about just happened all of a sudden, they didn't used to be like that, but all of a sudden they feel agitated, they feel irritated, they just feel restless, and and they can easily be irritated, you can easily get to their nerve without even trying so hard. That is also one of the signs to really watch out for. And the last sign we're going to talk about today, there are so many different signs, but the last one I'm going to talk about today is feeling worthless and guilt. That feeling of guilt and worthlessness just dawned on you. You just feel like maybe you're not trying so hard, or you feel like you've failed your loved ones just out of the blue, even when you know that you've been trying so hard. But it just kind of dawns on you, and you start to feel worthless. You feel like you don't matter, you don't deserve to be even here, or your loved ones start to feel like that. Sometimes it can come through from like the way they are talking about themselves or how they feel, or sometimes you can feel it, so if you're feeling those feelings of guilt and worthlessness and it's not going away, sometimes you can feel, we all have felt those feelings sometimes of mostly guilt at some point. But when it just is out of nowhere and it's persistent, and you keep feeling like you don't deserve to be here, you feel like you're blaming yourself for random things, you're blaming yourself for why others are not happy, or you just feel guilty for just random things. Some people even feel guilty for being alive, they feel like they shouldn't be. So when it starts to intensify like that, you need to seek professional help as early as possible. Or if your loved one is experiencing these things, you need to seek professional help. Thank you. That's it for today. Have a good one.